Here's you, young or youngish. You've got plans for your life and you want to call Nova Scotia home. You're healthy, so healthcare isn't something you'll think about until you have to. No family doctor? No big deal. But while you might be healthy, Nova Scotia's healthcare system has been sick, and its worst symptoms have gone untreated for 30 years. But don't just take it from me. This is Tiffany Cuthbert. She had breast cancer. She came to Nova Scotia from Newfoundland hoping to find better healthcare.
I was wrong.
You'll hear more from her in a moment, but first, here are the facts behind the symptoms. Nova Scotia is old. Call it the baby boomer bubble. Almost 20% of its population was older than 65 in 2017, and several more percentage points are waiting in the wings. That means a large chunk of Nova Scotians are entering an age of chronic and complicated illnesses. To care for those people, we'll have to funnel more money into an already strained healthcare system. And by we, I mean younger people who are still making money and paying taxes. But as you might have heard, Nova Scotia has historically struggled to get young people to stay.
And meeting doctors' needs is the second biggest problem. Nova Scotia pays its doctors the least compared to other provinces. Doctors' salaries are one of the most closely guarded secrets in government. Making matters worse, more than half of working doctors in Nova Scotia are older than 50, making them part of that retirement bubble. Meanwhile, new graduates have significantly higher debt loads when they finish school, and that means they're looking at new, faster ways to pay that down. That means the days of solo family practices and house calls are dwindling. The shift towards a more collaborative model of healthcare, clinics with nurse practitioners and the like, may also be slowed by a resistance to change. Even then, some doctors have said their wishes to move to areas in need of physicians have been challenged by the Nova Scotia Health Authority. In 2015, the program that filled about 45 doctor vacancies in Nova Scotia by assessing the skills of foreign-trained physicians was axed. It had existed for a decade and saw about 100 doctors participate. In November 2017, Doctors Nova Scotia said it was hopeful a new iteration of the program was nearly ready to be rolled out, but still needed the province to give it the green light.
And there's the third obstacle, politics. Long-term planning for healthcare is hampered by the 4-year election cycle, which can be too fleeting to effect positive change. On top of that, the province's relationship with labor unions has become increasingly toxic since the 1990s, especially with those representing healthcare workers. It can be argued that things started to sour when John Savage, a doctor himself and father to the current mayor of Halifax, was leader of the Provincial Liberal Party. The Savage government introduced the Public Sector Workers' Wage Bill, which rolled back wages for thousands of people. For the next 2 decades, feelings of resentment further divided healthcare workers from the government.
And Mr. Savage, take a good look, because there's a lot of us out there.
One of the chief complaints of doctors who have left is that they're underpaid compared to the other provinces. And now 5 governments later, healthcare reform has become the 4th issue. You see, the healthcare system used to be managed by 9 different districts with 9 different CEOs responsible for their own doctors and facilities. When Stephen McNeil and the Liberals were campaigning in 2013, they promised to save the province millions of dollars by amalgamating those districts into one. That became the Nova Scotia Health Authority in 2015. But while sound in theory, 3 years has been too short a time to prove whether that move can cure a disjointed system. And while that's been happening, the wait list for family doctors has grown, an issue that affects an estimated 100,000 Nova Scotians. The province's Auditor General blasted the newly amalgamated health authority late last year, saying the focus on administration has led to a lot of confusion and potential stress of people not knowing where things are heading. And he noted that poor communications has hampered whatever plans it has of fixing the doctor shortage.
It should not be a surprise to anyone that these snowballing problems have been created and worsened with time, rolling a long distance to our doorstep. That's why young or youngish people shouldn't wait until they need medical help to care about healthcare.
And that's why CBC Nova Scotia is looking at solutions to the problems that have led us here. The stories CBC is producing as part of our health project will examine what's working, what's not, and find those people who are making a difference.